Dry eye is a multifactorial disease of the tears and ocular surface, with many risk factors that can lead a patient into the dry eye vicious circle. The circle has 4 target areas that contribute to the pathophysiology of dry eye, including tear film instability, hyperosmolarity, cell death, and inflammation. While the circle can be entered at any point, hyperosmolarity is considered the primary driver and should always be considered within dry eye therapy. There is now an expanding pool of clinical data on the efficacy of dry eye therapies that include osmoprotectants such as erythritol, taurine, Trehalose, and L-carnitine. Osmoprotectants in dry eye disease may directly protect cells against hyperosmolarity and thereby promote exit from the vicious circle of dry eye disease physiopathology. Trehalose is the key ingredient in a unique dry eye product, Thealoz, which is a physician-only dispensed preservative-free multi-dose artificial tear. Thealoz is an exciting advancement in the treatment of dry eye due to the unique mechanism of action of Trehalose. Trehalose is a natural osmoprotectant and bioprotectant, protecting cells of the cornea and conjunctival surface from the effects of hyperosmolarity and desiccation. It does this in 3 ways. It maintains cell volume by acting like an osmolyte, balancing the osmotic pressure on both sides of the cell membrane, thus limiting the movement of water out of the cell. It also stabilizes the lipid bilayers in the cell membrane, providing a further protection to water loss from the cell. Additionally, it is known to aggregate around and alongside proteins in such a way as to stabilize and prevent denaturation of the proteins, thereby protecting cell function from the effects of desiccation. Taking this understanding to the vicious circle, it can be seen that Trehalose is active at multiple targets. The natural osmoprotectant and bioprotectant nature of Trehalose is superbly demonstrated in nature, in the Rose of Jericho, which naturally synthesizes Trehalose to protect itself to remain fully viable even after undergoing complete dehydration 24 hours after receiving water. Thealoz, the natural bioprotectant for your moderate to severe dry eye patients.